Hey everybody, my name is Gracie Harrington, and I was assigned Chapter 6, which is on role disputes. So to get started, a role dispute is a situation in which a patient and some kind of important person in their life have differing expectations about the relationship. So the book calls it a non-reciprocal expectation. So I felt like it was easiest to kind of understand within an example. So the example I came up with is about a couple, Jenny and Steve, who have a 1-year-old child at home. Jenny works full time while Steve stays at home with the baby. So since Jenny is working full time, when she comes home, she expects Steve to have the house clean and have dinner ready. But Steve has the idea that since Jenny has been gone all day and he's been at home cleaning and taking care of the baby, she should come over and when she gets home, she should take over household chores like taking care of dinner, doing bath time, things like that. So both partners feel as though they're right and have these different expectations for each other within their relationship. And they've been struggling to get out of this rut despite how often they've argued about it. So some other important things about role disputes is if one of the partners may have depression or some kind of mental health disorder, we might see that this leads to an increase in their symptoms because of the role disputes. A lot of times, role disputes come up in interpersonal therapy when the disagreements have come to a stall. So maybe you're having the same disagreement over and over again, or despite fighting over it over and over, you never really come to a mutual agreement and things don't really ever improve. So for the therapist's role in interpersonal therapy, there's 3 main goals for treatment for role disputes. So the first is helping the patient identify the disagreement and then choosing a plan of action, and then helping to modify the communication or expectations within the partners or whoever is the loved one to the patient. So for example, with Jenny and Steve, that first step, identifying the disagreement. So if Steve is our patient in interpersonal therapy, the therapist might help him to identify the pattern of disagreement. So for this couple, it looks like the main issue is identifying who's going to take care of the household chores in the evening. Oh my goodness. Okay. The next step is choosing a plan of action. So that might look like creating an alternating chore schedule so that both parties are sharing the load of evening chores during the week. And then lastly, modifying the expectation. So for our couple, Jenny and Steve, that might look like creating the expectation that both partners are going to help out and share the load during the week, and even talking about their struggles or where they need extra help. So if there's a certain night where Steve has had a really, really bad day and he needs extra help with a certain thing, even if it's his day to do the chores, talking about that with Jenny and seeing what kind of agreement they can come to. Yeah, that's all I've got for Chapter 6. Thanks.